I am Dr. Becker. I am past president of the American Institute of Homeopathy, and I would like to welcome you to our AH webinar series. We have Professor Samir Chaukkar today, who is from India, is a homeopathic practitioner, is MD homeopathy from India, and he graduated in 1992 from Mumbai, did his postgraduate work from the British Institute of Homeopathy in UK, and had his MD homeopathy from the prestigious Mumbai University. Also completed his postgraduate work in addictions treatment from Canada and a fellowship in advanced homeopathy from the Other Song International Homeopathy Academy. He has been on the faculty of many homeopathic colleges, namely Virar Homeopathic College, Virar Chinchwad Homeopathic College, Batil Homeopathic College, Rimpri, and YMT Homeopathic Medical College, Mumbai. He's professor in the Department of Materia Medica for the last 25 years. He's presently attached as a dean at Dr. Batra's Homeopathic Academy, Mumbai. She's affiliated to the Maharashtra University of Health Science. He's also teaching in Turkey and Brazil in their advanced postgraduate courses in homeopathy. Dr. Chaukkar specializes in the treatment of allergies, asthma, arthritis, autoimmune disorders, ADHD, autism, and other learning and behavioral disorders. He has presented many research papers at various national and international conferences and seminars in Dubai, Brazil, Turkey, Malaysia, Canada, USA, Australia, and New Zealand, to name a few. He has had much success in the treatment of autistic individuals, helping them to gain a high level of functioning, both intellectually and emotionally. Without further ado, I'd like to present Dr. Chaukkar and welcome him to our presentation here. You can start your presentation.
Okay, are you able to see my presentation? Okay, so can we start?
Yes, go ahead.
Okay. So good morning, everybody. A very good morning to all of you. Some of you, it is a good afternoon and maybe some good evening also. And I have put into my groups also, so it is good night for them there. But anyway, good evening and good morning to everybody. Today we are going to talk about a very important topic, which I have been trying to do something about it in my past 10 to 15 years, trying to see what exactly happens with autism and what are these children and how they suffer from. And it's not only the children, but also their parents that play an active role in the healing and recovery of the children. So let's talk about what is autism. First of all, let us know what autism is all about. So first thing, it is a spectrum disorder. That is the first thing that we need to know, that it is not one single symptom which can diagnose autism. It is a spectrum. It is a combination of symptoms. It is a combination of kind of a syndrome. Therefore, it is known as spectrum, and it goes from the left side of the spectrum to the right side of the spectrum. So you may have an autistic kid with totally kind of a lag. He's behind, learning disabilities there, or it could be a Down syndrome, it could be mental retardation, it could be a comorbidity like epilepsy. On the right side, you will have extremely intelligent autistic children also. So today, in fact, I was talking to one of my colleagues and we talked about autistic savant children who are very, very intelligent children. And I'm sure that all of us have seen the movie Rain Man, in which Dustin Hoffman was, he acted very well as a autistic adult. And we saw how intelligent he was. He was able to, even learn the whole directory of names and the numbers, which is the seventh variety of these autistic children. So on the right extreme, we have the Asperger's syndrome, which is the intelligent variety of autism. Asperger's syndrome was always considered different, but now it is considered under the autism spectrum disorder. So autism spectrum disorder usually begins in early childhood and eventually causes problems functioning in society, socially. This is very, very important in school and at work, for example. So the thing is, we have to understand that many a times a child is born normal and he progresses normally in his milestones, but at a particular level, at about 2 years, 2.5 years, he starts regressing behind. And when he starts regressing behind, the mother will always come and tell you that he was talking, he was walking, he was crawling, all his milestones were good. But the problem happened something, there was some fever, some vaccination, somebody died in the family, the pet died, the grandfather died, the father left home, or something happened and he started regressing. That's where we have the concept of primary autism and secondary autism, so that we will talk about later on. So often children show symptoms of autism within the first year. Therefore, early diagnosis is very, very important. Catch them early is the most important thing in autism, because if you catch them early, the morbidity, of course, there is no mortality, but morbidity is much less, and the reaction to homeopathy is very, very fast. I have seen children with maybe 4 or 5 years, they respond much better than children who are 7, 8, 9 years old. So catching them early, and of course, in order to catch them early, we need to educate our parents, our patients, and their children, and also their friends about what autism is, how to diagnose it. Even without a psychologist, if you see some signs, immediately rush to a homeopath or to any psychologist or a psychiatrist, but take help as early as possible is very, very important. A small number of children appear to develop normally in the first year and then go through a period of regression. So, this word is very, very important, my friends, because regression is something which happens due to some event. And when you go to the repertory, you look never well since, or ailments from in our complete repertory, or even any of the repertories. Even if you look at Murphy, you will get ailments from. You have got ailments from vaccination, ailments from death of a parent, ailments from quarrels at home, discords between parents. There are so many ailments from, and if you catch this ailment from, you'll be able to make difference in autism. Remember, so regression between 18 to 24 months of age when they develop autism symptoms. While there is no cure for autism spectrum disorder, again according to the allopathic science, intensive early treatment can make a big difference in the lives of many children and their parents. I would add that also. It's very, very important. Now, what are the causes of autism? We have seen post-COVID, there is a lot of increase in autism as well as a lot of problems of children, because children have been officially addicted. I would again say they're officially, because there were no schools, there were no offices, everybody was at home. The parents were on computers, the children were on computers, the children were on gadgets, and nobody could say no to them. And now the problem is, now still nobody can say no to them because they have got addicted to it. So excess gadget use.
Sorry, Dr. Chaukkar, can you expand your screen so we can see your slide a little bit?
Is it okay now? Is it okay?
No, no, it's on the left top right. There's a little expansion on the PowerPoint, so you can start.
I'm doing this slideshow, and from the
Yes,
current
right
slide,
here.
I'm doing this.
There
Right?
you go.
It's okay?
Uh, yeah, but it's
Because on my laptop, it is shown as a slideshow, it is
is
increased in
it
some.
is it is it
Yeah,
expand?
yeah, yeah, yeah.
It's not doing it on ours for some reason.
But
Can you
anybody
start
else?
from, can you push the beginning?
I don't know whether it's moving. Is it moving up and down?
Yeah, it's moving, but we don't see the whole slide.
Because I'm going to the slideshow, I'm putting it now. Anyway, I'll stop sharing and share again.
Yeah, try again.
Is it okay now?
That's better. That's it.
The only thing is it should move. Yeah, it's moving, right? Is it going ahead? Okay.
Yes, it's moving.
So excess gadget exposure becomes one of the most important things nowadays in today's world post-COVID. That's why it's known as a virtual autism. Remember, because it's kind of a virtual reality that they are in, and also the stimulus. Remember, when a child is exposed to the gadget or the video games or whatever things are there today, the thing is that only two of his senses are overstimulated. One is the visual and one is the hearing sense. Otherwise, all other senses are down. Remember that. And this overstimulation of the visual and the hearing sense can lead to a lot of problems in the brain. Remember that. Second thing is lack or excess of oxygen at birth. Now remember, this is one very important thing, especially in complicated pregnancies or even abuse during pregnancy. This is one of the topics that I presented at Spain LMHI, where I talked about role of abuse in mothers leading to autism in children, where abuse in mothers can surely lead to decreased oxygenation to the infant or the fetus while in the womb, and this can surely damage the brain and cause problems. So we had a series of mothers. We looked in our patients in Turkey, and we had so many mothers. They were either physically or sexually or financially, psychologically tormented, tortured, or troubled during pregnancy, which caused their children to develop autism. So we had a series of cases like this. So we could prove the fact that abuse can surely lead to some damage to the brain of the fetus. Third is, of course, vaccination. Of course, I don't feel that vaccination entirely is the culprit, because until unless there is a genetic component, until unless the person is genetically predisposed, as we call the fundamental miasm, vaccination cannot damage the infant or vaccination cannot damage the child, because we all were vaccinated. We did not develop autism. So development of autism is not a single, it is a multifactorial things. So it is not only the vaccine, but a genetic predisposition also can lead to autism. Fourth point, I was just going through the presentation and I came to understand that delayed marriages. Now, the thing is, the mother and the father, they are going into career, they want to plan their career, they want to start their home, and they plan their pregnancy. They either take some kind of contraception, or even if the first child is about to be born, they undergo abortion or they go undergo medical termination of pregnancy. And this leads to the second child being born late. So, late marriages and the late first child can also lead to autism. Again, we go back to the lack or excess of oxygen at birth and complicated pregnancies. Remember that. And of course, there are many like fragile X chromosome, rubella, encephalitis, untreated phenylketonuria, infections during pregnancy, and consanguineous marriages. Genetically, we have seen that in many castes and many religions, there are consanguineous marriages between the first cousins, and this could lead to a lot of genetic problems in children, and of course, autism also. So this is what the thing is. You need a genetic predisposition and the environmental toxins or the environmental insult in form of vaccines or infection or oxygenation, which will lead to autism. This is the most important understanding that we need to have when we are treating children with autism. Now, what are the early signs of autism? Onset within the 3 years of life. Now, remember, when a child is born, the parents are looking forward to the developmental milestones. They are always, taking photographs, they are doing videos, and they want the child, okay, when the child starts walking, crawling, giving them a social smile. This is very, very important for parents. The first time they are going to become parents. But what happens? This child looks at one object constantly. Okay, does not give eye contact on calling, does not respond to his name, does not give a social smile. When you call the child by his name or just call him by the way, and the child doesn't look at you, does not even give you a social smile, imagine the tragedy to the mother, right? So, child does not recognize family members. The child is busy in his own world. That itself tells us what autism is all about. They are busy in their own world, right? They don't respond with a smile or happy expression, limited eye contact, does not mimic sounds by 9 months, doesn't babble or coo, no response to name, doesn't gesture, doesn't say single words, doesn't play make believe, doesn't say two-word phrases by 24 months, and loses language. Now, loses something which he has gained and he starts losing is very, very important. The mother is going to say that he started speaking, he was everything was okay, he started speaking two letters, three letters, and now he's not able to do, and he's now totally speechless. This is a common scenario of autism that you see. Remember that. So, how do you diagnose autism? Basically, autism will come to you in a packet, remember. So, they'll have many issues together. But if you segregate them, if you separate them, first of all, there are some behavioral issues. Most of the autistic kids will have a ADHD component in them, such as hyperactivity will be there, temper tantrums will be there, poor attention span, decreased concentration, poor focusing, which is the characteristic of all autistic kids. We are not interested in all these symptoms as homeopaths because we need the PQRS symptoms. We require the characteristic symptoms of the child and not the symptoms of autism. Now, remember, when parents come to us, the mother starts talking symptoms of autism, and we are really not interested because she knows about autism more than us. Remember, because they have been going through literature, googling everything, finding out what is autism, and they know more about autism than me too, and they will start talking. But this is what I always educate the parents, the mother, the father first, that when you come to us, this is what I need to know. I don't need to know no eye contact, echolalia, which are the characters, which are the common symptoms of autism. Right, in Organon, Hahnemann had told us, Dr. Hahnemann told us that what is curable in the disease and what is not curable. So you're not going to look at the common symptoms of the disease. We have to find the characteristic symptoms of the disease. So hyperactivity, temper tantrums, poor attention span, decreased concentration, and poor focusing, they are the common symptoms of the disease. Remember. Secondly, there'll be problems with speech, language, communication. They don't know how to communicate. That's very, very important. The challenges with communication, they don't understand social cues, they don't know how to react. And lastly, social skills. This poor eye contact, poor interaction with peers, and they appear aloof. Remember, this is what the mother would say, that he doesn't mix with other kids. When we go on the playground, when we go out into school, whenever there's a parent teacher meeting, when we go to parties, my son is just sitting in the corner and he just refuses to play with somebody. He's as if aloof, as if he's in his own world. So this is problems with social communication and interaction, more or less the same thing. Has poor eye contact, does not speak, delayed speech, speaks with an abnormal tone or rhythm, and may use a sing-song voice or a robot-like voice. Now, this is one thing which I always tell parents, because they always talk of speech therapy. Remember, with speech therapy, we have seen the speech coming in the child, and with homeopathy, when the speech comes in the child, they are totally different. With speech therapy, the child speaks like a robot. Remember, they speak like a parrot. We don't want our children to speak like parrot or in a robotic tone. We want them to speak naturally, and therefore, I usually, in my practice, I tell the parents to stop their speech therapy and give chance to homeopathy to work along with the occupational therapy, of course. So repeating words or phrases, echolalia. Now, if you see in the repertory, there is a rubric repeats everything what is spoken to him. In answers, if you see the rubric answers, repeats. So there is only zincum metallicum. Yes, zincum metallicum is an important remedy for autism, but you cannot give zincum metallicum to all the cases. Baraita carb is an important remedy, but I have seen so many homeopaths starting for every autistic kid, they will start with Baraita carb. It doesn't help like that. Brings bad name to homeopathy. So he doesn't express emotions or feeling. Now remember, he's not expressing emotions. Does not mean that he doesn't have emotions. He has emotions, he has feelings, but appears unaware. Doesn't point or bring objects to share interest. Inappropriate approaches a social interaction. Now this is very, very important, that there will be some children who will be totally aloof. There will be some children who will be intruding into conversation. So what I have gained in so many years is that I have seen that autism is all about hypofunctioning and hyperfunctioning. On all the senses, there'll be hypofunctioning or there'll be hyperfunctioning, and the child will present to you with some senses are hypo, some senses are hyper, and these are the rubrics that we'll be selecting. So later on, I'll be also talking about the rubrics that we'll select in case of autism. So has difficulty recognizing non-verbal cues. Like parents, when they say, shh, don't speak in between, he doesn't understand that. He'll go on speaking. So he's not understanding what is the tone of the people, what the parents want, all these things, right? Fascinated by details of objects. Remember, this is again called steaming. Steaming is not only doing making a single noise, but even looking at one object is steaming. Putting hands on the ears due to small noises or big noises or sudden noises is steaming. So steaming is not only the voice or the noise that they make, but steaming is all these kinds of behavior. So spinning the wheels of a toy car, unusually sensitive to light, sound, or touch. So we have remedies, in homeopathy, we have remedies who are very, very hypersensitive to noise and who are hyposensitive to noise. So when they are hyposensitive to noise, they are going to make noise. So we have belladonna. I'm just trying to bring in homeopathy so that we all are, on the same line here. So when belladonna comes to us, he's going to make noise. Why does he make noise? Opium makes noise. Veratrum makes noise. Why do they make noise? Because they are hypofunctioning, remember. Hypofunctioning of the sense will make them make a lot of noise which they don't understand that they're making noise. At the same time, when any sense is hyperfunctioning, now imagine in belladonna and stramonium, they have got aversion to light also many times. So they are going to close their eyes or they're going to close their ears. So there could be hypofunctioning and hyperfunctioning. fixates on an object. Rigidity of behavior is very, very important in all autistic kids. 95% to 99% of kids will have rigidity of behavior, for which homeopathy is excellent. I am also using batch flower remedies in my practice. Recently, when I was in US, in New Jersey, we did a small seminar on autism where we talked about batch flowers, and many batch flowers out of the 38 are very, very important remedies for autism, and I have used them very, very successfully along with homeopathy. Has specific food preferences such as eating only few foods. He wants the same food. I'm going to show you a case whereby an adult autistic, we won't say he's a kid, he's a young guy who's 24, 25 years old. He has to go to the same McDonald's every day, 50 kilometers up, 50 kilometers down. His mother has to take him all the way. Remember, every day for the last so many years, this is a ritualistic behavior of autism. They have to go every day, and sadly, this is the behavior that I'm not able to do anything about it because it just stays there. Rigidity of behavior is very, very difficult to go. Remember. Now, homeopathically, when we are looking at autism spectrum disorder, we have to look at three important patterns. They'll come to you in patterns, remember. Not that these patterns will be fixed, all the patterns will be mixed, but predominantly the child will come to you with a its sensory pattern. Sensory pattern means they will have lot of sensory disturbances. Either they are, as I have told you, hypofunctioning or they are hyperfunctioning. So oversensitivity to noise or touch, etc. Some children will come up with predominantly motor pattern or kinetic pattern where there is extreme restlessness and impulsiveness. At the same time, third type of children would be marked degree of regression. Involuntary urine, involuntary stool, eating stools, low cognition. So accordingly, we can see there are distinct repertorial totality and repertorial syndrome. So there are distinct groups of collected symptoms as well as group of medicine. So this makes our approach to autism easier when we put them into patterns. Remember that. Now let's look at the sensory pattern. Hypo and hyperfunctioning, as I have told you. Impairment in receiving and processing of sensory input with intensity as well as qualified aspects. Remember, touch, sound, smell, vision. Now there are, we say that we have got five senses, but actually we have got seven. So there is a proprioception also. Remember, vibration sense is also there. Therefore, we have children who have got fear of downward motion, fear of sitting in a merry-go-round. So remedies like borax, I have seen borax given in a case of autism working very well, where we know that borax is an important remedy for aphthous ulcer or maybe some female reproductive system problems. But borax was also used to a child who was sensitive to noise, very sensitive to slightest noise, and had a fear of downward motion. And on based on these two symptoms, borax was given. So any remedy can be given for autism. There are no specific remedies. So parents, they report that child startles by sudden sound, closes his ears, etc. This aspect is a hallmark of autism and is responsible for a variety of symptoms and states. Now, if we look at borax, stramonium, asarum, theridion, carcinosin, nux vomica, opium, china, these are the most important remedies where management of autism, where a sensory pattern is predominating. Now, you'll say, what is asarum? Now, asarum, theridion, they are sensitive to slightest noise. Remember in Materia Medica in Allen's, they say even the crackling of a newspaper will cause irritation in asarum and theridion. Theridion is so sensitive to noise that it sets the teeth at edge. It's so, and he's so sensitive. Remember, carcinosin is sensitive to the slightest dirt. Remember, carcinosin is sensitive to the slightest remark. And carcinosin, remember, has become my favorite remedy along with medorinum for autistic children. Remember it because they are very sensitive. Nux vomica, again, very sensitive. Opium, china, these are some remedy with spectrum with sensory pattern is predominant. Second pattern was the kinetic or motor, right? So majority of these children are belonging to autism spectrum disorder with hyperactive state. You will see children running around and the mother would say as if there is a motor on their legs, and they're just, when they enter your clinic, they just start running here and there, touching things, throwing things, destroying things. So there is a lot of hyperactivity, impulsivity, along with destruction. So it becomes easier that there are certain hyperactive children who are not destructive, but there are certain hyperactive children who are destructive. So we have remedies. Hyperactive, only hyperactive, there could be maybe tuberculinum, tarantula, but hyperactivity with destructivity could be a mercury also. Remember that. Could be a cuprum also. So we need to understand and classify these symptoms so our remedies become more and more easy. The group of drugs that come around are tarantula, stramonium, tuberculum, medorinum, nux vomica. Now, why medorinum? Because the mothers would say that my child is a night person. And that's what Vitulkas has also said in Materia Medica, that these are people of night. That means the children are awake all day or awake, they are kind of sleepy all day, but in the night they start gaining more energy. In the middle of the night at 2 o'clock, 3 o'clock, they are the most hyperactive, which is very common in children with medorinum, children with autism, that the mothers would say that he's just not sleeping. I have to give him melatonin, and only with melatonin, or even with melatonin, does not sleep. So in these children, medorinum would really act very well. Now, along with hyperactivity, there could be self-injurious behavior. So we have got remedies like lysinum, hydrophobinum, which we commonly call stramonium, tarantula, tuberculum, belladonna, many remedies. You look at the rubric: striking himself, striking head on the wall, falling backwards, temper tantrums, meltdowns. These are very, very important things in the kinetic pattern. The third pattern is the regressive pattern. Here, children, this is what the left side of the spectrum I was talking, where the children are associated with some Down syndrome, epilepsy, delayed learning, poor sphincter control. They pass stools. The child is sitting in front of you on the table. He'll take his saliva and apply on the table and then start licking it also. He may pass stools and start eating his stools also. Poor sphincter control. Lot of dull and passive state. Here we'll think of remedies like Bufo, Baraitacab, Hyoscyamus. These are low-minded, remember. Bufo, very, very important. Masturbation in children. They don't know that they are masturbating, but they get some kind of pleasure. This is a sensory pleasure they get. So many mothers would come and say that my child is sleeping on the bed on his stomach and rubbing his genitals or holding his genitals. So masturbation in children, you can again think of Bufo, again you can think of Medorinum. Very, very important remedies. Hyoscyamus is of course there. So this is some pattern that I have developed, where sensory pattern, kinetic pattern, self-injurious pattern, and regressive pattern. This diagram is very, very useful. But again, any pattern can go into anything. Remember, all drugs belong to all the patterns. We have to look at the predominant. We'll have to look at the characteristic symptom. Remember that. Okay. Now, if there is a characteristic expression in the autistic child, the child may show affectionate nature, his desire to be associated with people or group. So the parent is going to tell you that he likes to be with, but if they don't, you need to have it in your questionnaire. That does he like to be with people? Does he like to be cuddled? Does he like to be caressed? Does he like to be kissed? Is he also kissing people? Is he also cuddling people? Or he has an aversion to being cuddled? So on one spectrum, you may have remedies like phosphorus, carcinosin, and all the affectionate remedies like pulsatilla who would like to be cuddled. Now remember, I have given pulsatilla also in autistic kids. That's very, very manipulative kids. Remember that again. Right? On the other hand, the child could be absolutely averse to touch, averse to even being looked at. We are thinking of remedies like antimony crude, antimony tart, senna, chamomilla. These are the remedies. So you have got both the spectrum. So you need to know both the spheres, right? So we have seen drugs like phosphorus, carcinosin, lycopodium coming up in these features. Now, if the child has aversion to cuddling, put it in your question. The mother would say a lot of things. Remember, the mothers are full of anxiety. Fathers are more or less neglecting the children. They hardly know about the child. So mother is the only person who can tell you. Until unless the father is a single father and there is no mother, then the father can give you a good history. But otherwise, if both the parents come, I rely on the mother's history. But mothers also come mixed with a lot of anxiety, remember. So take their symptoms with a pinch of salt. It's very, very important. Because you need to go back into, when she says my child is restless, we need to know what do you mean by restless. All children are restless. All children like ice cream. There is not a single child who does not like ice cream. Yes, if one child does not like ice cream, I would take it as a characteristic symptom. But craving for ice cream is not a characteristic because everybody likes it. So whether liking, desires, that's why Kent in his repertory writes desires. Some author would say craving, some author would say likes. What is the difference between like, cravings, desires? We need to simplify that. We need to be very, very clear when you take a craving, because in a mental illness, Bonnie-Olsen also has said that the physical concomitants are very, very important. So whether it is autism, whether it is ADHD, whether it is schizophrenia, whether it is conduct disorder, whether it is learning disorder, whatever it may be, physical concomitants will ultimately clinch the diagnosis of the remedy. So a desire for ice cream is not a craving for ice cream. Desire for sweets is not a craving for sweets. I had children, the mother would say that he just cannot live without sweets. He wants sweets with everything. We had a case of sacrum of Vishnalis. whether when the child would actually go around finding out sweets here and there, and the mother clearly said that whenever he would have sweets, he would be very, very hyperactive. So based on only that indication, sacrum was given. And of course, sacrum has desire for a lot of love and caressing and cuddling. So based on that, we had given sacrum officinalis for a case of autism, and it worked wonders. So these characteristic PQRS physical symptoms are also very, very important. Qualified aspects of fears. Now, what is the kind of fear? Fears also help us appreciate the drug. For example, gravitational fear like borax, argentum nitricum. These children are not never ever going to sit in the merry-go-round because it goes up and coming down. So whether going on the top is a problem or coming down is a problem, we'll differentiate between the argentum nitricum and borax, because borax has problems when he's coming down. So the child cries. Yes, the father would say he was okay as long as we were in the merry-go-round. It started, and when it went on the top, he was okay, he was enjoying. But as soon as it went down, he started crying. He started holding me and clinging me, which is a typical symptom of borax. So there also you need to differentiate between borax and argentum. Is it fear of heights or fear of downward motion? So fear, qualifying the fear is very, very important. Qualifying the restlessness is very, very important. It is a spectrum disorder. Some children showing gravitational fear would be scared of jumping even from a small height. Remember that. If you know all of us know the remedy agaricus. Agaricus, if you see in the proving in Borix, he has given the 4 stages of poisoning by mushroom. In the second stage of poisoning, he cannot judge distances, and that's why agaricus is in the rubric danger, no sense of danger, fearlessness, runs about in the most dangerous places. These are the symptoms of agaricus. Why does the child leave the hand and run away without any fear? Because he cannot judge the distance. This is very, very important. It's not only the fearlessness, but inability to accurately judge the distance is the problem of agaricus. Remember that. So it's not only the restlessness of tuberculinum and tarantula or recklessness of tuberculinum, because tuberculinum, though recklessness is there, he knows how to take care of himself. But agaricus will not be able to take care of himself. Remember. It's very, very important to differentiate even between the restlessness of children. Agaricus would jump from a height or run on the road without knowing this danger. Now, Dr. Shankaran always gave importance to this rubric, runs about in the most dangerous places of agaricus. Remember that. So running about, there are many remedies, but runs about in the most dangerous places. Like my son just gets up in the morning, we are on the third floor, he goes on the parapet and walks with no fear at all. He will cross the road just running like that without even knowing there is a car coming. So these parents are terrified by the act of the child, remember that. And homeopathy can surely help them. Tuberculinum will do the same, but he is reckless and audacious, liking to take risk, remember, while agaricus is not aware of the danger. That is how do we differentiate between tuberculinum and agaricus, because they have come very, very close. Remember, both of them have got delayed milestones, delayed speech. Both are good remedies for ADHD, autism, but you need to differentiate again based on cravings. Remember, very, very important. Now, the concept of autistic savant and its reflections in the homeopathic case anamnesis. The autistic savant is one of the most fascinating cognitive phenomena in psychology. It refers to individuals who have got extraordinary skills, okay, which are not exhibited by even the most normal kids also. There are many forms, like you may have mathematical calculations, memory feats, artistic abilities, musical abilities. A small girl knows how to, play the guitar or the piano without even formal training. This is very, very important. After formal training, anybody can be trained, but these are the children who don't require. I had an autistic child around 5 or 6 years old, and he knew 4 or 5 languages. One of my cases in Turkey here, when I was many, many years back. This child, of course, I gave him carcinosin that time, and he did very, very well in carcinosin. So they have got extraordinary feats, which is very, very important. So this is the right side of the spectrum. So we saw Baraitas and Hyosamas and Bufos on the left side. We see carcinosins and phosphorus and tuberculinums on the right side. So this is a autism spectrum disorder. Okay. Now in homeopathic case taking, we know the importance of all these things, but obstetric history, the pregnancy of the mother, as I have told you, the primary autism and secondary autism. So many a times you always ask the mother's history during pregnancy. Yes, it is very, very important, but it is especially important if the child is born and there are no milestones. If milestones are not approached at all, if milestones are not coming or they are not coming in the proper order, then you can think of some problem in the mother, remember, during the pregnancy or during lactation. And then you may find out a positive history which might correlate the mother's remedy to the child's remedy. But imagine a child is born normally, Everything is okay. For 2, 3 years, he was absolutely okay. Some event happened and he started regressing back. At that time, asking the mother of the pregnancy history is important, but is not as important as primary autism. So in secondary autism, look at what caused the problem and go to the repertory, find out ailments from. You will get ailments from grief. Okay, the mother could be too much in grief. Now remember, I had a patient of autism where the mother was pregnant, and in Turkey there was a huge earthquake long many years back. Of course, recently also there was, but this was the earthquake which happened many years back. She was pregnant around 7, 8 months. She delivered the child, and during the earthquake, she had to run out. Her husband was not there. She was all alone. She was pregnant. There was nobody to help her. So there was so much fear. And the child was also born with all these symptoms. So a stramonium state of the mother was transferred to the stramonium of the child, who also developed these fears, remember. And stramonium helped the child. So this is how pregnancy history is so very important. Birth cry, immediate or delayed, again is very, very important, because I told you one of the causes is less oxygen to the brain. Now remember, one of our colleagues has started a oxygen therapy center for children of autism in South India, where he's treating children with oxygen. And he's trying, and I mean, he just started it, but the results are quite encouraging, which means that there is a component of oxygen also required for the autistic kid to become okay, along with the constitutional remedy. Mental emotional state during pregnancy, very, very important. Ask about trauma, abuse, unwanted child. Very, very important. Many a times the child is kind of, they are planning, they are into career, they want to do their job, they want to earn money, they want to make their house, and suddenly she finds out that she's pregnant, even after using whatever contraceptives they were using. And she becomes pregnant, and the first news is like a shock to her. No, how can I get pregnant? And this shock travels to the child, remember, the unborn child. They decide to keep the pregnancy, they deliver the baby, and later on the baby develops certain things. Now remember, it's not always autism, always. Let's not say only autism is developed by this, but many other problems can be developed, remember. But this state of pregnancy, the state of mental emotions during pregnancy, even during lactation, when she's feeding the baby, what mind, whatever things are going through her mind, the mother-in-law is torturing her, the father-in-law is saying something, the husband is not behaving properly with her, but she's feeding the child is very, very important. So feeding history and the history of the mother is very, very important. Look at the milestones, whether they are normal, delayed, find out sitting, crawling, of course, that is common thing. Find out speech, whether it is receptive, expressive, whether any regression was seen. Major events at the time of regression, like death of someone.
Sorry to interrupt you. Just quick question. So would you find that in those cases where the mother has been affected by her family and with anger, with suppressed anger, you would find staphysagria working for the patient?
Yes, yes. Why not? Why not?
Yeah.
Why not?
Okay.
Of course, I will have to find out some staphysagria component in the child also. That's very, very important. I wouldn't give a remedy blindly to the child without the component of the mother in the child. Remember that. Many a times the mother develops cravings which she never craved in her life. Remember. Now, this is very, very important, and we have found out in so many cases that it is the craving of the child in the mother. It's not the craving of the mother, remember that. So the mother would say, I never used to like lemons, but I don't know, since the pregnancy, I started eating lemon just like that. And that craving I have taken in my totality of symptoms in the child, remember. And it has helped me to give belladonna many a times. The mother wanted freedom. Now remember, I had a case, I remember that when she was pregnant, the husband was so dominating, and she wanted to go out, she wanted to wear kind of dresses that she wanted freedom. The husband was not allowing her, because they were from a conservative family, so she was not allowed to be free. But the child, when he was born, again he was kind of freedom, restlessness was there. So you see, there was a great desire for freedom in the mother. There was craving for lemons there. And in the child also, you saw many symptoms of belladonna coming. And that's how belladonna state can also traverse through the uterus, remember. Now, always it is not possible. Sometimes it is possible. Sometimes it is not possible. So I would give importance to mother's history, especially as I have told you, in primary kind of autism rather than secondary autism. So one of my friends who's also doing a lot of autism, he says that ask the mother whether they have got photographs of the first year party, birthday party. Many of the parents, they celebrate the first year of the birthday, and during the look at the photo, what was the child doing, whether he was enjoying, whether they have also videos of the child, or they take clips of the child, and the child was talking, maybe interacting properly, the child was enjoying, which means that there was no autism at that time. Are we getting it? So this is how you can just, I mean, in order to just confirm whether it was a primary type of autism or secondary type. So in autism, what I do is I learn from all the homeopaths around me. There are many homeopaths all over the world who are doing good job in autism. They are treating lots of children with autism. And when we read them, when we see them on the YouTube, we learn a lot of new things. So my learning is not only my experience, but it comes from all my friends who are all homeopathic doctors, right? Look at the temperament of the child, whether he's sensitive, weeping, disposition, irritable, silent, destructive, revengeful, impatient, obstinate, sympathetic. All rubrics are there. Remember that. Okay. Look at the hyperactivity, hypoactivity, or dull. How is the child during the acute attack? Of course, now when you say autism, there is nothing like acute attack. But this is one thing that I have learned, that whenever the child has any asthma or cough or any fever or any problem, ask the mother that during the fever, how was he? Because by the time they come to you, they have given some paracetamol or something like that. The fever has subsided. The child was crying whole night, but when they come to you, the child is sleeping. So the sleeping child or the silent child or the calm child is not the child to be treated. The child who was crying all night, the child who had fever all night, the child who was having a tremendous meltdown in the night is your patient and is your totality of symptom. Remember that. So ask the mother, how was he before coming to me, because that is very, very important. Sitting tolerance, eye contact, response to commands, temper tantrums, reaction to anger. What does he do in anger is very, very important. My child is very, very angry. What do you mean by angry? What does he do? Whether he throws things, whether he cries, whether it is hitting his head, whether he hits his mother, is spitting or is pulling hair. All these things are important. All these are our rubrics, remember. Head banging, or they sit in the corner weeping. I've even given Ignatia to a child, where a very, very important rubric we have seen in Ignatia is jealousy in the newborn. Jealousy in the newborn, or jealousy in children when the newborn gets all the attention. Now, there are only two remedies in that. One is Ignatia, one is hyosamus. There are many children I have seen where autism was developed, or so called there were changes or deviation, neurodegeneration was there when the new child is born. Because it is normal that the mother's attention is towards the new child or the newborn child, and the second child or the first child feels neglected. At that time, whether the child becomes violent and kicks the new child or takes care of the new child will differentiate between ISMS and Ignatia, right? So social skills, again, fear of animals, dark, thunderstorms. Does he like to go in the dark? Does he have any fear or no fear? Very, very important. Performance in the school, again, very, very important. Whatever school they go to, whether they're going to a special school, whether they have a shadow teacher, whether they are going to normal school, whatever school they are going to, ask about the behavior in the school and at home. Remember, we have remedies like lycopodium. I've given 100 times in children who are very, very, very good in the school, and the teacher would vouch for him that he is the best student in my class, doesn't do anything, helps me in everything. But this child, when he goes back home, is so dominating, so derogatory, abusive on parents, because he feels that they are inferior. So soft with superiors and hard on inferiors. We have got lycopodium, we have got platina, we have got veratrum, we have got lycasis. Only four remedies. If we get this symptom, again, it's very, very easy to differentiate. Remember this. So parent teacher meeting is a very, very important thing. Ask the mother what happens at the parent teacher meeting. What does the teacher say? Because nowadays we know that our schools, I mean, our children are more at school rather than at home. Remember, there are 8, 9, 9, 10, 10 hours of schools, and the children are more at school than with parents. So in fact, the teachers are the second parent. So you need to take the teacher into confidence and ask her. Ask about her observations about the child, whether he is interrupting the child, interrupting the class, whether he's disrupting the class, whether he's sitting alone, whether he goes to toilet many times, all these things. And all these things I have seen in my practice, remember. Activities preferred at work or play, reaction to scolding and insults in public as well as in private. Because many a times when the mother starts talking about the child, he's doing this, he's doing that, complaining about the child, look at the child's reaction. How is the child looking at? The child may also react in an abnormal way. Many a times we as homeopaths, we know our case taking is so important and case recording is so important. We are so busy in writing the case that we don't look at the chemistry between the parents, chemistry between the parents and the child. What is happening in front of us? And we lose vital cues, we lose vital data, and we come to the remedy after 2 hours when we can come to the remedy in 5 minutes. Maybe the remedy is the same. We can come in 5 minutes also, in 2 hours also. But it depends upon your own observations. In children, observation is a primary skill. We need to develop that skill. In adults, they cover their problems very, very easily. In a way, psychotic miasm. Remember, they cover, and you will not understand an adult very easily. You will not understand abuse in a lady very easily. She will take 4 or 5 sessions with you till she develops confidence in you and she'll start speaking something. Similarly, a male will talk of his erectile dysfunction after many sessions till he develops, kind of a rapport with you. But a child, remember, whatever he is inside, he is outside. Of course, if it is a manipulative child like Tarantula or Pulsatilla, you will never understand the child. But there are many children who will be what they are outside, who they are inside. So developing the art of observation is very, very important. Obsessions, gestures, peculiarities, past history of illness, family history, these are other common things. Appetite, motion, thirst, desires. Now, this is one thing which I give a lot of importance. Desires and aversions in children with autism. Remember, they have typical desires. You will see a lot of children eating lemons, remember. And therefore, one of my prime remedies that I always think is belladonna. Belladonna is one of the prime remedies for desire for lemons. Medorinum for sour fruits, green fruits. Mothers come to us and they say that he likes only green apples. He will eat only green apples, no red apples, no other fruits, no other sweets. He'll like green apples. He'll eat ice. Now, this is again a very, very important symptom of phosphorus, medorinum, calcarea phos. These are veratrum album. These are the children who will even eat ice. They like everything chilled. So lemon, ice cream, salt, licking salt is very, very important. We give natramutes, phosphorus to many a children who have come with autism and with introverted nature, aloof, not talking to others, not expressing their feelings. Natramute is an excellent remedy for autism. Remember. And remember, borax also belongs to the natrum group. And that brings us to the fact that natrum itself is a good group for autism, remember. Kali, yes, Kali has ritualistic behavior. Kali has aversion to change. But I haven't seen Kalis mostly in autism. I've seen natrums in autism because they're more introverted, remember that. Aversions are again very, very important. Aversion to milk and aversion to many other things. Sleep position is yet another thing that I lay a lot of importance. Other than the mental symptoms, how does the child sleep? And we have got very, very limited remedies, and the mother is going to say that my child sleeps on his abdomen. And you got very, very limited drugs. Yes, there are many, but limited drugs that you see in your practice are carcinosin number one, medorinum, we got calcarea phos, we got tuberculinum, sleeping on abdomen. So this position can clinch your diagnosis, shorten the spectrum, or maybe narrowing the spectrum to 4 or 5 remedies, and then ask craving, aversion here and there, sleep position, and immediately you come to remedy. So it becomes easy. Though it may not be as easy as I'm sounding or as I'm talking, it's not so easy, but still it makes our task much more easier. Okay. Perspiration, which parts? Palms and soles, yes. How much is the perspiration smelly? Silicea, Baryta carbs, Lycopodium. These children will have perspiration and it will be offensive smelling. Silicea, the mother would say that whenever he comes from school, we just cannot bear the smell in the room. It permeates through the whole room. And I always tell him that go straight to the bathroom and put your socks there. Don't even remove your socks here. So Silicea, Baryta cup. Of course, Baryta cup will have his own personality. So you cannot just think of perspiration and give Baryta cup. You'll have to have a Baryta cup like child in order to give Baryta. Remember that. Urine, again, normal flow, bed wetting, very, very important. Up to what age, again, is very, very important. Is it a primary nocturnal enuresis or a secondary nocturnal enuresis? That means he stopped and he started again. Maybe a fright. Now, remember, if you read Louis Hay, who has done such a great work on psychodynamics, just like Sigmund Freud, she has done a lot of work on psychodynamics. And one of the causes of nocturnal enuresis in children is father fear, fear of father. Remember that, very, very important. So a strict father can always give rise to a lot of children giving nocturnal enuresis. So finding out that history, so learning about psychodynamics, learning about illnesses and the psychodynamics behind them will also make you make your own case paper, will come to the diagnosis early, come to the repertorial rubrics very, very early. Remember that, and will save your time. So nowadays we are also learning a lot about psychodynamics and we are also practicing it in our practice. Okay. So how does a child behave in the waiting room? These are the things that I would lay stress on. How does a child enter your dressing room, waiting room? Whether the child enters first and the parents, whether the child pushes the door and enters, whether the child would knock and look inside and would be shy to enter. Again, these are the remedies. These are our remedies. So one of my friends has written a book on case taking before case taking. Are you getting it? So case taking starts much before we actually start noting down the data from the parents or from the child. It starts when the child enters into the clinic. I would go beyond to say that it happens in the waiting room. So many a times I feel an ideal clinic would be where there could be a single vision glass and you could see outside what's going on in the waiting room, because that will give you vital clues about the remedy of the patient. You will see how the child is restless. You will see how the adult is talking to everybody and gossiping. You will see how people are fighting with each other or arguing with somebody or talking to your receptionist. All these are very, very important things. So, what happens in the waiting room? What happens? How they enter into the room? How they sit and how they sit? Whether they are standing, whether they wait for you to tell them sit down. Tells us about carcinosin children, silica children, good boys, good girls. Remember that. Dr. Vijaykar used to talk about good boys and good girls. So we have Ignatia, Carcinosin, Phosphorus. These are the good children. Silicia, Pulsatilla, good children. On the other hand, we have children who are, rowdy children. Who like we have got Hyoscyamus, we have got tuberculum, we have got tarantula who don't care. Lachesis are the curious children. Sulfur are the curious children who will try to look into your computer, try to look what you're doing. So all these are important things, that how does the child behave in the waiting room. What does he do after entering? What is his reaction when you look at him or try to examine him? What if you offer him a toy or chocolates? Is he still saying still or restless? Is he obeying what the parents say? Reaction of the child to what the parent is talking about him. Reaction when you talk about the child to the parent. Look at the child. Look at the child. Look at the parents and the child. Don't write. We keep on writing, and we forget the vital clues. Of course, writing is important, case taking is important. That's why they say case receiving. Let's not take the case, let's receive the case. Because when you're receiving the case, you are observant. When you're taking the case, you are more on a higher pedestal as a doctor and patient. When you are as a doctor and patient, it becomes too difficult, because when the child is running around, you look at the child, don't do this, you're stopping the child from expressing. Or when you tell the mother, please take care of the child, why is he running like this? Please make him sit on your lap. Doesn't help, because it's going to totally destroy the picture of the disease. Remember, the picture of the patient. Let him do what he wants. That doesn't mean, of course, break your stethoscope and break your computer, but at least let him do what he wants. That's very, very important. So these are some rubrics that I have seen in my practice. So I have taken these important rubrics. Curious. I've seen a lot of children being curious. They come out near your laptop, look at what you're recording, look at what is this? Why is this like this? What are you doing? Are you recording my case? They'll come and do antiques plays, doing like this, mimicking, jesting in front of the computer. So curious becomes the lachesis, very, very important remedy here. Lachesis, pulsatilla, phosphorus, sulfur, don't forget, remember. And of course, also see who is the author who has introduced the remedy, because this is very, very important. Nowadays, you know that even we all can introduce remedies in complete repertory and synthesis repertory. So finding out the rubric and who has introduced it into the repertory is very, very important. How many people he has used for proving? How was the proving done? Go to the background of the proving of the remedy. There'll be many remedies added. There were only 4 or 5 at the time of Kent, and now there are 40 remedies, which means there were 36 remedies added after Kent died, which means that not all are authentic. You need to find out the author. Remember, it's very, very important. Precocity of children. In the autistic 7 children, I use this rubric, precocity of children. The mother would say, he's much mature than his age. He helps me when I'm not well. He's so alert. Like Ignatia, like Carcinosin. These are the children who are very, very precocious, remember. And again, Medorinum, Lachesis, Veratrum. Contrary, it does exactly opposite of what? Very, very common in autistic children. Very, very disobedient children. Contrarily, doing exactly opposite of what is told to them. Tarantula, very, very important. Now remember, tarantula is contrary, even tuberculum is contrary. And we always thought tuberculum was contrary, but this was a discovery for me at least. I always thought that tuberculum was a prime remedy. In contrary, doing exactly opposite of what is told to him, tarantula will also do. But the only difference between tarantula and tuberculinum is tarantula will do it in a very, very hiding way. He will not let you know that he's doing it in opposite manner until unless you know about it later on. That's why a tarantula child's mother says that when everything is quiet, then I'm scared because then I know that my child has gone somewhere and doing something. So that is the diagnosis of tarantula. While tuberculinum will do it right in front of you. If you don't like a vase, that's what even Vitolkas writes, that he will destroy the most precious item that you feel it is precious. He is intentionally malicious. That is the word for tuberculosis. While tarantula will be malicious, but in front of you, he'll say, "Oh, I did not do it. I don't know who has done it." And you might believe him. Remember that. That's very, very important. It's not only that he lies, it's not only important that he manipulates, but he makes you. He will create a situation that threatens you and will make him agree. Remember that. Okay. Restless in children, again, don't look at the rubric 69 remedies. Try to find out what is he as restless, whether he's jumping, whether he's climbing, what is he doing? Again, belladonna, jumping, climbing, very, very important. You see, these are the remedies that will come very often in autism, remember. Animals, very, very important again. Disgust for animals or love for animals, or in the same child, both. So, medorinum is the remedy, remember, for both disgust as well as liking for animals. But mostly carcinosins, calcareous, calcarea, lachesis, tuberculum will have love for children, remember. Nature loves. Asking the mother whether he likes to go to a mall, whether he likes to go to play electronic toys, or whether he likes to go in a garden or a playground to play with children. Very, very important question, remember. Which will help you again divide the remedies into two because there are few remedies that they love nature and that is carcinosin, very, very important. Kali self is there, remember that. Vanilla, Triticum vulgaris, phosphorus, very, very important remedies. Remember. Traveling desire for, wander desire for. Again, the difference is destination known, destination not known. Tuberculinum is in both of them. But remember, calcarea fos is only in traveling, not in wander. Though it is in small marks in wander, but traveling and wandering desire. Very, very important. You will see this in the clinic, remember. Traveling is a question that you can ask, but wandering is something that you will see, remember, because he will just come in the clinic and not run around, but he'll just walk around looking here and there, moving from one part of the clinic from. He's just like that at home also. He's just like that outside also. Confirm with the mother whether it is traveling or whether it is wandering. So it's very, very important to differentiate this. Cunning. Now, this is an important variety of children. Cunning, deceitful, mischievous children. We have agaricus, tarantula, lachesis, nux vomica. This is a variety of children who are cunning, manipulative children. Now, remember, autism, we feel that, okay, this kid can't be like that, but these are the kids and these are the characteristic symptoms that these kids will be. They'll be deceitful, cunning, manipulative. You see pulsatilla. I've given a pulsatilla kid where the kid was so manipulative and cunning that whenever her father would come, she would start crying. She would sit on his lap and she would say, "I want to go out." Without even caring that the father was not well or father had just come from the office, she just wanted to go out. They will do anything to get love. They will do anything to get care, to caress, cuddling. They want just love at any cost. That's why many authors compare pulsatilla with a sponge. They just soak everything. They don't care about others. They just soak. So that's the hypocrisy of pulsatilla. That's the manipulativeness of pulsatilla. That is the cunningness of pulsatilla. Though it really, deceives us completely, saying, "Oh, she's such a nice kid. She listens to me. She does whatever she wants, whatever we tell her." But inside there is a cunningness, manipulativeness. So we have to understand this cunningness and manipulativeness of pulsatilla. Many times we might think of a tarantula or pulsatilla. Remember, coming very, very close. Remember, I have confused myself many times between tarantula and pulsatilla also, which is strange. We might feel pulsatilla is totally different than tarantula is. Even phosphorus. We always think of phosphorus as okay, is absolutely okay, but there might be some problems. Remember that. Destructiveness in children. Now, what is destructive? What is he? Whether he's throwing things, whether he's breaking things, whether he's tearing clothes. Look at qualifying feature. Today's session, I just want to lay stress on only one thing, that whatever symptoms we get, don't take, yes, take big rubrics, but try to find out what are the intricacies of the rubric. Find out destructiveness of clothes, throwing things at people, tearing things, biting things. These are important things. So destructiveness is a big umbrella under which all these things will come. Find out the smaller versions and try to narrow the spectrum, remember. Biting in children, biting his own arm, spitting, pulling hair, tearing clothes. These are all various qualified aspects of destruction. Remember that. A very, very important rubric I have found very, very useful is behavioral problems in children. Remember, few remedies, 27 remedies are there, and these remedies will be covered in ADHD, will be covered in autism, will be covered in all behavioral problems. Look at cuprum metallicum. So if you got opposition defiant disorder, or you got conduct disorder, you got aggressive children, you got children who want to put things on fire, behavioral problems in children. If there are a lot of fears along with behavioral problems, think of stramonium. Now see the rubric behavioral problems in children, but good at school. This is important. Look at the remedy lycopodium, thuja, and tuberculum. Only three remedies. They are good at school, but with strangers. They are good at school and with strangers. But at school, they create a lot of problems. So, behavioral problems in children like that. Destructiveness in children. Amusement. With this gadget addiction, we have seen how children are getting addicted. My child just whole days with the gadget and he's totally engrossed in the gadget. He's not even aware of passing stools or passing urine. Many a times he's passed urine just there when he's watching his cartoon films. That means amusement. He's right into it, remember. So they always say there's a difference between amusement and entertainment. Remember, entertainment, you're watching a cinema, you're watching a movie, but you're also eating popcorns, you're talking to your friend, a phone comes, you can talk on the phone. But with amusement, you know what amusement parks are. When you're in a roller coaster, you just don't know what's going around you. You're just into it, remember. So that is the amusement and that is the remedy. Lachesis, remember. Lachesis is a very, very important remedy for amusement desire. At the same time, Ignatia and Baraita would be amusement averse too. These are the children who would just sit in the corner without even seeing TV or watching TV, watching cartoons. He doesn't like to see anything. Even if strangers they come, he's not interested. We can think of Baraita and Ignatia. Antics playing in children. Very, very important rubric. In autism, I have seen the children making fun of you, mocking, jesting, doing lots of faces, gestures. This is a very, very important rubric. Remember. Gestures and antics playing in children, making faces, mimicking, jesting, mimicry. Laches is very, very important. Girls, little girls liking to wear small frocks, small skirts, trying to show off, putting a lot of nail paint, putting a lot of lipstick in young age. Sexually developed, sexual precocity in children. So coquettish, very, very important rubric in children. Look at lachesis, phosphorus, platina, and veratrum. Meadorhinum also should be there. I think it can be added in this coquettish children because these are the girls who will get prematurely sexual, remember. At around 7 years, 6 years, they will like to wear small frocks, trying to show off, trying to run around, dance around. So this precocity, sexual precocity in children, very, very important. Caress, very, very important to be. Caress, cuddle, kiss. Don't forget to ask this. Then only you will know the hyperfunctioning and hyperfunctioning of them. There will be children who will have caress aversion to. They'll have children desire to be caressed. Now you see completely two different rubrics. 19 remedies in aversion to be caressed. 15 remedies in desire to be caressed. Some of them will be common, remember. Some of them will be common. Calcarea is calcarea floor, calcarea falls, and here calcarea is there. But what is important is this narrows the spectrum of your remedies. Affectionate. Is he really affectionate or is he hypocrite? Remember, affectionate is pulsatile also. Affectionate is hyoscyamus also, but they are totally different remedies. Why hyoscyamus is affectionate and why pulsatile is affectionate is an important thing. At some other time, maybe we can do we can do a small webinar where we could differentiate these remedies. It will be very, very interesting, of course. Probably I am thinking of coming in, I was thinking of coming in April for the JHC, the Joint American Homeopathy Conference. So if I come around that point, probably we could do a live small talk also on differentiation of pediatrics remedies. Okay. If it
Right.
is, if it can be done. Okay.
Yeah.
So disobedience in children, defiant, dictatorial. Look at the remedy. Remember Dalkamara. Now, Dalkamara is a remedy which we always think of, okay, rainy season problems, cold coryza, but Dalkamara is a huge constitutional remedy, remember. With the dictatorial aspect, with the aversion to change, just like Kalika. Remember, Dalkamara and Kalika come very, very close. It's very, very important remedy. Dalkamara is a very, very important remedy. I've given it many times in children also. Causticum, again, defiant, revolutionary. They don't like whatever is happening around. They want to have their own say. That's causticum, remember that. disobedient children, dictatorial children. Okay. So now what I'll do is I will share a case with you. I'll show you a case. Barbara, yes, 99. I wouldn't agree with you, Barbara. 99% of children, I don't think they like to be caressed. I would say it could be 60-40 because in my practice, I've seen children even not liking to be caressed. I mean, I'm sure you have seen 99%, but what I see in my little practice of 10-15 years of autism, I see that 99% is too big a figure because
Yeah,
most of the,
they
you
don't.
will have lots of cinas, chamomillas, antimony roots, creosote, remedies like creosote. Remember, creosote is also a very, very important child remedy because it is in the rubric caressed averse to be.
Mm,
Not liking to be caressed is important.
mm, mm,
Yeah, maybe. Yeah, you're right in a way, not liking to be caressed because it's a negative. Negative symptoms are always more important. That's why we give a lot of importance to aversion rather than cravings. Remember, because aversions are very, very clear. When you say, I don't like milk, you can see it on the face of the patient that you don't like milk. But when you say, I like sweets, everybody likes sweets, right? Very few people would say that I don't like sweets. So, anyway, you're right in a way. But then what I feel, Barbara, is again, we differ in caressed at least. Okay. What repertory do you use? I use both synthesis as well as complete repertory, sir. Sometimes Murphy also. What is V?
Maybe
V is,
Vijay Ekkar. Did you mention Dr. Vijay Ekkar's name?
yeah,
Maybe.
yeah, yeah. Dr. Vijay Kar. He's no more. He unfortunately died in COVID, but he was a great prescriber. And the concept of good child, bad child, diligent children, intelligent children, he's given it very, very nicely. I mean, he has written some good books. I am sure these books are available if you would like to read about him. He's written very good about miasms and everything. Good understanding.
Mm.
Very, very good teacher. We miss him very much. Any other question?
So there's been a good proving of sacrum officinalis. I don't we don't often.
Yeah, sacrum officinalis was proved by I don't get his name, but the one who discovered cease therapy.
Yes, Titus. What's his name?
Tennis Smith. Right, yeah. So he has written an excellent version of Sacrum Officinalis, and even if you go find out from other books or maybe on the internet also, Sacrum Officinalis are again there's a lot of care, motherly aspect, lack of care from mother, feeling of lack of care. So this caressing, cuddling will be there a lot in Sacrum Officinalis, but the most important symptom is they have sugar or they have anything sweet and they become hyperactive. On this indication itself, absolutely, you can give sacrum officinalis.
Mm.
At least I have 3 to 4 cases of sacrum where the mother told me that we just hide sweets because if he has sweets, he becomes absolutely unmanageable.
In the
So,
U. Unfortunately, in the U.S., it's almost every other mother says this.
yeah, yeah, I know. I think more than even in US, even in India, every mother is scared to give sweets now because you become more aware about sweets and processed things. But with these children, to keep them hidden or to keep them somewhere in the house is also difficult because I have some children who can do anything to get whatever they want. They'll just go to the kitchen, they'll take a chair, they'll go up, they'll open everything, and they'll do all sorts of things. So it's very, very difficult to control these children. So I will just show you one case here. Let me share. Can I share? No.
Yeah.
Okay. Can you see?
Yeah. If you can expand it.
Yeah. So you see the kind of self-injurious behavior. This is the remedy. This is the kid or the adult kid I was talking about,
Mm.
where the rigidity of behavior is there, and and after the remedy, we saw that. See, now, this kid or this child was a kind of autistic savant, remember. So he learned using gadgets at a very early age, and he was able to, and now still he is able to do 4 or 5 gadgets at one time, watching them, controlling them, doing a lot of videos together, which a child will not be able to remember. So that was the seventh character in him. Now with his history was, I would just go through the history here. uh, when his mother was pregnant, she was kind of driven out of the home by her in-laws, by her mother also, not in-laws, by her mother, by her father, by her grandmother. And during pregnancy, she was treated as if she was not existing. She was absolutely treated as somebody who's not existing. Can you see the case of 2021? So when I asked them what are the symptoms, it was back in 2021 that I talked to them. Most challenging issues were his rigid routines, like driving him to McDonald's and few other shops every morning, little after sunrise. So this was a regular routine for the mother. Now remember, the mother was quite old. The guy is around 23, 24 years old, and he would absolutely be unmanageable if he's not taken by the same car, if he's sitting in the same seat, going to the same McDonald's, going by the same road. He has to see the same things around him, then only you can manage him. And that is the rigidity of behavior of autism. He spends all his days watching cartoons from different tablets at the same time, and TV has to be on at the so much hyper stimulation required. Can you see this hyper functioning of senses due to which so much stimulation is required to these kids? Picky eating, which is again a common symptom, he eats only fries, sweets, chocolates, likes ice creams, goes to toilet. He had another problem, and this is yet another problem in autistic kids, lot of constipation. So constipation and sleep are the two issues that the mothers are going to come to you with, and this is what we have to deal with. Remember that
Can
he's
you,
very withdrawn, not talking or engaging.
sorry,
It
are
also, yeah.
you able to expand the screen?
Actually, it's expanded here.
Yes,
Yeah,
for some
I'll
reason
stop and
it's not
I'll do it
expanding.
again.
Yeah. Hmm.
Is it?
No, not yet.
No.
It's not a big deal. It's just it's hard to
Yeah,
read.
because I'm talking out. I'm
Yeah,
talking out
it's
with the
not a
cursor
big
on
deal.
the.
Not a big deal.
His perception is very good. When I ask her how is this child as a person, which is very important question for all of us. So perception is very good. He's able to talk but does not prefer. He has learned to read and write by himself and can read and write in English. Knows many words in English. Now remember, the patient is Turkish. Okay, so English is not very common here, but they speak. He was speaking English and many phrases. He's sensitive to disapproval and criticism, becomes agitated and takes a while to calm down. You saw how agitated he was, how he was beating himself. Feels better when he's praised and shows affection. His regression, now the mother said that the regression started when he was 6 months old. We moved to a very dark and moldy place. I cried and didn't want to stay there. But his father insisted. He never was able to sleep there throughout the night. Now, initially, I thought maybe the moldy place or with a lot of concepts of, fungal, candida infection and autism, fungus and infection, fungus and autism. I thought maybe the moldy place and the fungus played an important role. But later on, I found out that it was something else. It started after we moved to another city and permanently left his childhood house. So he felt protected in a childhood home where he was born, where he stayed. Remember that, right? Which he cried to go back for years. He likes being around people, can entertain himself, withdrawn, doesn't reply to hello, he gets very upset, fears dog, doesn't have any family other than me. His father lives far off in another city. Okay. When pregnant, now this is very important. I asked the mother that tell me something about your pregnancy history. So when pregnant, we had to stay at mom's house. She always complained to other family members about me, nagged me about sleeping too much. I was very sleepy during pregnancy. I once wanted to leave the house. Eventually, my mother asked us to move out of the house. and I was 8 months pregnant. So imagine the kind of trauma this woman went through during her childhood till her pregnancy. The mother treated her, ill treated her, but at the time of pregnancy also the mother was not good to her and she was driven out of the home. Now imagine driving out of the home during pregnancy, number one, and a place which is secure and you are totally out into the new world and you are treated as if you are not existing, as if you are somebody who's not required in this world. My both parents were very negative, nagging and disapproving, always critical, favoring my younger brother. So I felt unwanted, burdened and unworthy. So the mother came out with the history on her own, remember. She said, I asked her, what did you feel exactly during pregnancy? She said, not only during pregnancy, but this is the feeling which I carried from my childhood. So imagine the depth of the feeling: unwanted, burden, unworthy feeling. My grandmother also took her side. She got very angry and reprimanded me. So when pregnant, we had to stay at my mom's house. She always shamed me, complained to my father and grandmother. I once wanted to leave the house. Eventually, she asked me to move out. How my mother treated me as a child, treated me the same way when I was pregnant. This was very, very important. There was no abuse from my husband. I felt unwanted, burdened, and disapproved. Now, the what has happened is this mother carried this feeling during the whole pregnancy. The child was born, and the child was born with autism, maybe after some months of going from one place to another. Now, that place was a protected place. The place was something that they always loved and he craved for, even at a very, very young age. They had to move from one house to another, went to a moldy place, a dark place, which again did not have any affection, no love, only the child and the mother were there. So the same feeling of being unwanted, being a burden, being thrown out from the society went from the mother into the child. So both of them came with the same picture. And the basic feelings that I took for both of them was forsaken feeling, deserted, despised, abandoned, repudiated feeling, thrown out, left on your own, unwanted. There was a separation conflict, feeling of outcast. Now, many a times, right in the beginning, I thought of the remedy magnesium carb because it deals with a lot of forsaken feeling, neglected feeling, feeling of not being included. So magnesium carb was thought. But at that time, there was one more remedy that came to my mind, looking at all the rubrics. When I looked at ailments from grief, forsaken feeling, delusion, despise, repudiated, unfortunate, and in the child, we saw a lot of destructiveness. Thought of the remedy Hura Brasiliensis. So I did not have that remedy at that time. So I had to bring it. So till then I gave them Saclac for some time. But then ultimately I got only the 30 potency and only one dose of that remedy. And I tried to think about, let me think something apart from, out of the box feeling, because we all think of magnesium carb every time in the forsaken feeling. Why not think of another remedy? So that's how I gave her Hura and that's how it worked. It worked miraculously in the child. Obsessions were within a month. Obsessions were better by 75%. Rigidity of thoughts were there. He started interacting with his mothers. Violence, irritability was better. Screaming has stopped completely. Stools were better. The most important thing is physical sphere was also getting better. It's not only the mind should get better, the mind and the physics both should get better if your remedy is right. Sleep was much more refreshed and better. No nightmares. Ura again 30. I had given in water. I gave only one dose again in water and placebo for 2 months. Just getting better and better. Rigidity of thoughts remained, interactions better, stools okay, and placebo for 3 months. He's still doing very well, still under my treatment, and he's on placebo. At times, he requires Hura 200 or Hura LM sometimes, and he's doing very well with Hura. So, this was one case that I wanted to show you, which shows how the mother's history can transmit into the child. There are many other cases. Now, this is yet another case I wanted to show you how this child is self-eating behavior, very, very characteristic in the children and very, very difficult to control. Remember, this child always wants to have his blanket. If he doesn't get the blanket, he will start eating himself.
Can you um, can you advance your slides?
Can you see the video?
We just see the one slide has been there.
Okay.
Hasn't.
You can't see the video.
No, no.
You can see this slide now.
We just see the case of adult autism, but we
Oh,
don't
okay.
see anything else.
So probably we don't see. Let's stop sharing.
We didn't see the video either before.
Okay, I'll show you. No problem.
Mm.
Okay, can you see this slide now?
Yes.
Can you see this?
No.
Now,
No.
can you see the slide?
We can just see the slide saying case of self-injurious autism.
Uh,
For some reason, that's not. Uh,
why we can't see the video?
let me see if
You can see this slide, right? This case of self-injurious autism.
I'm trying to see my.
Yeah.
Okay, now I can see.
Yeah, just let me share again. Okay, you can see this. So I'll do one thing. I will not take it on the slide mode. I'll just take the next slide.
Yeah,
Okay,
yeah.
and but I'll have to do it on a current slide. Can you see the slide now?
We just see the case of self-injurious autism slide.
Still the same?
If you try to go to view, there's up. You have view, maybe there.
View.
Slideshow, review, and then view. And just click the view, and you probably have the expanded view.
Slideshow and view.
No, go up. Up and yes, next. Next is review, and then is view.
Okay.
And try slideshow.
It is not. Anyways, I think we've already seen one case, so we can see this case at some other point. So just wanted to show you some cases of self-injurious behavior, which is very, very characteristic. So as I have said, and as I always think that it is more of a integrated approach. That means we as homeopaths cannot deal with such a condition alone, and we'll have to have the help of a psychologist, a psychiatrist, a physician, a counselor, also occupational therapist and a speech therapist along with us. So it has to be a integrated approach of all the therapists together, which will help us to tide the crisis. And treating the mother as well as the father, as well as the siblings along is very, very important. It's not treating us does not always mean giving them homeopathic medicines, but also counseling them and making them understand what autism is all about and what we need from them. Because until unless we have the support of the mother, support of the father, and the way they behave with the kid at home is very, very important. Because if you're giving the right remedy also, if the behavior of the father, mother, or if there are parental fights which are affecting the child, if they still keep happening, there'll be a lot of problems. So knowing the chemistry between the parents and children, between the parents themselves, their behavior at home, how it affects the child is very, very important. And then I think autism will be we'll be able to manage it. I wouldn't say cure, but at least manage it in a positive way, and we can make them more creative and productive in this environment. So thank you very much. I hope I was able to at least develop an interest about what we can do for autism. And at some later time, Alex, whenever we can do something live, I would love to be there and do some live seminar.
Yes, we can talk about that. Are there any questions at this point? Does anyone want to unmute themselves? They can.
Batch flowers, I think somebody asking. Harold
Yeah,
and
Bach. I think the pronunciation you're using Bach. For some reason, in it's always people have always said Bach, but actually you're correct. It is Bach. It's an Irish
But
He was
but
Irish, much, much.
yeah, I mean pronunciation, I don't think it really makes a big difference as long as you know how to use them.
Exactly. Yeah.
So just
Any
on a
other?
lighter note, but it is really useful. And in fact, I have got such good results with back flowers that many a times I now give batch flowers rather than homeopathy. So they are simple also. They can be selected easily. They can be given by anybody who has a proper knowledge of batch flowers.
Hmm.
Most important thing is there are no side effects. Many times homeopathy, even though in 30th potency or even in LM potency, I have seen some violent reactions in children with autism.
Hmm.
So
Right. Right.
handling the children as well as parents becomes difficult at some time. So I think starting with the batch flower and bringing the child down, controlling the meltdowns, and then maybe starting a constitutional remedy has been my approach lately.
Hmm. Hmm. Barbara asked about the Veratrum, the child of needing Veratrum album. I assuming she's means.
Yeah, veratrum is usually I see in children, lot of children with lot of defiance and lot of anti-authority behavior, just like Cuprum metallicum and all. But most important is their cravings, of course. The craving for ice cream,
Nice.
cold drinks. And another important thing is the despair of their, I mean, they would like to show off their position, which is very, very important. That's why it is known as the Prince of Homeopathy, because Prince is somebody who doesn't have any responsibility. So they would really, be so defiant and so anti-authoritative, even in school, college, defiant as far as attention is concerned, as far as writing notes from the board is concerned. Lot of complaints from the teacher is one of the things that I think of Veratrum. Remember, just like Lycopodium, the teacher would say is absolutely best character. Veratrums and cuprums and tuberculums and tarantula, there'll be a lot of complaints from the teacher. So these are certain points that I look for.
They're also violent, right? Veratrum can
Yeah,
be
yeah, absolutely,
violent.
absolutely. They can be
Hmm.
violent, very, very restless, doing the same thing again and again. So autism, I have seen a lot of Veratrums.
Hmm. Hmm. And any other questions from anyone else? Padmini?
Yeah, do you give back flowers and the homeopathy same time or one after the other? How do we dose
No,
it?
I used to actually give my initial way of practice is always one single homeopathic remedy and phytum or placebo. That is what I've been doing for last 30 years. But after I've learned batch flower remedies, I have started giving the homeopathic similimum and a set of batch flower remedies instead of giving a placebo. And I feel that they have really helped me in my practice. They have helped me cool down the patient. And many people do say, and there's a lot of argument about how do you know what is acting, whether batch flowers are acting or whether your homeopathic remedy is acting. Yes, it's an important question, but still I feel I give both of them together many times, and my practice has, I don't know whether you'll believe me, but tenfolds it has flourished after I started using batch flowers.
And when you give both, you give the homeopathic remedy first and whatever potency, and then continue with the bath flowers
So I would
as
give
a daily
weekly.
dose. Huh?
Homeopathy, I would give weekly, maybe every Sunday, the homeopathic indicated remedy. Well, between Saturday, from Monday to Saturday, I would give batch flower 4 or 5 times because batch flower remedies have to be repeated at least 4 to 5 times in a day. They cannot be given a single dose. And second thing is any change of behavior, any change of emotion, you'll have to stop the batch flower remedy because otherwise they are placebos. The important thing is changing of emotions and conversion of a negative emotion to a positive emotion is the indication for you to stop the batch flower. So my follow-up for batch flower is not come after 1 month or come after 1 week, but tell me tomorrow how is he feeling or day after tomorrow how he's feeling. It's very, very important.
If
So you
you're
would.
using the homeopathic remedy, what potency,
Hmm.
and do you use it every week or every month? Or
I usually always believed in high potency, so I was a high potency homeopath, being a follower of Dr. Shankaran for a long time. But in autism, especially, I've seen I have started using 38 and 30 going to 200. And if I see good results with 30 or 200, then I don't go to 1M, but I go to LM potency. My
LM?
usual way is to 30 to LM or 200 to LM, and then LM more frequently. Because LM potency is the only potency that you can give more frequently without fear of any aggravation. Of course, I have seen some aggravations with LM also, but they are much more rarer than the centesimal potency.
Do you start with LM1 or
Yeah, I start with
LM,
LM1. I start with LM1.
LM1?
But many a times when I'm very sure about a remedy, I could jump from LM to LM3 also, and LM1, LM3, LM5 also. But when I'm quite sure and unsure about it, then I go slowly LM for maybe 15 days, 20 days, 2 times a day or 3 times in a day. Then as the patient progresses and shows good response, I go to LM2. So my criteria for repetition is good response, and the parameters are improving, then I raise the LM potency.
Is LM3 equal to 200 or how do you? Sorry,
Yeah,
that's
I
the last
mean,
question.
yeah, yeah.
Last question.
They say that, but then I don't fall into the nitty-gritties. I feel
No,
when I'm doing LM, I'm doing LM. I don't think of C or D at that time.
no, somebody is on 30 and you want to switch to LM. What would you?
So the thing is, the way I administer 30 and way I administer LM is little different. So therefore, even if it is the same as 30 or 200, the administration is in water. Administration is in distilled water in form of drops. So it is different. So I always start with LM1, even if it is 30 at that point.
Thank you.
Thank you.
Could you talk a little about how you use the Bach flower remedies? Do you give them in liquid and how often?
Now, depending upon how the child takes it, because I have children who don't take pills because of the sensory problem, so they'll not take pills, they'll not take tablets. At that time, I'll use drops in form of batch flowers. If they're able to take my homeopathic medicines or SL or Phytum easily, then I can just put the alcohol-based batch flowers into pills, just like our homeopathic pills, and dispense accordingly. The only thing, as I have told you, the dose is 4 pills 5 times in a day, because batch flowers have to be given 4 or 5 times in a day for proper action rather than once or twice. They are not like homeopathy that you give one dose and then wait for action. You have to give them fast because the vibrations have to be changed from negative to positive. So you have to give them more times in a day. That's the only important.
And the Bach flower remedies, do they have different potencies or is just a single
No,
one?
no, no, not potency. They are basically flower extract, so there are no potencies in that. Though there are some companies who talk of 30th and 200, but when 30 and 200 comes, it becomes potentized. So then they are homeopathic medicine. They are not batch flower remedies, and they are not proved. In a way, Dr. Batch found out these. There was no provings done of batch flowers.
Right. It's intuition.
Yeah, his intuition, and it was how he was a botanist. So many a times he looked at the flowers, how the flowers were segregated together, or the flowers were separate,
Mm.
or they were growing alone, or they were growing in groups. And
Mm.
that's how this symptom, and that's how, of course, everything is so right. And he was so intuitive and right that if you have the remedy heather, if you look at the leaves of heather, they are all mixed up with each other, which tells us that even the person is talk too much talkative, intrusive, will go and mix with others, will intrude the talk, he'll interrupt others. That's how heather is. At the same time, if you look at water violet, who are more aloof, if you look at their flowers, they are separately, they are quite away from each other. So this doctrine of signature, I mean, Edward Batch was a genius in
He
that.
was a genius, from what I heard.
Absolutely, absolutely.
Yeah.
Why did you start using the Bach flower remedies, doctor?
I have been using back flowers for a long, long time, since I started my homeopathic practice in 1992. But then recently I came across the Batch Center in UK, and then their proper training, online training, and the teachers all over India. There are teachers of Batch flowers, there are registered practitioners and teachers. So I did a level 3 course and also Batch flower practitioner and a teacher course also with the Batch Center. So now I'm both a registered practitioner as well as a teacher. So I think a formal training is essential rather than just reading, because
Mm.
formal training gives you a
Mm.
disciplined approach. When you read from books or from internet, maybe 1,000 sites are there of batch flowers, easy material available, and you can everybody know. You don't need to be a doctor, you don't need to be a homeopath. But with the formal training, I think we become more disciplined. We know exactly how it acts.
Mm.
Uh,
Mm.
that's how I think formal
Do you,
training is.
do you use the Bach flower remedies with patients who don't have autism or other
Yes,
things?
yes, absolutely. I've used it for allergies. I've used it for vertigo. Now, the thing is, I also connect the batch flower sensation to the physicalities. That means somebody who has got uncontrolled appetite. I had a patient of diabetes who tell me that, doctor, you do whatever. I'm going to eat sweets. I just cannot control sweets. And whenever it comes to the question of control, I think of only one batch flower remedy, and that is cherry plum. So cherry plum was given, crab apple was given for the obsession, because crab apple is also a good remedy for obsessive compulsive neurosis or disorders. So obsession for sweets and no control over sweets, and I gave him crab apple and cherry plum along with the simlimum.
So
And for
you'll combine Bach flower remedies.
yes, yeah, you can combine 6 remedies at a time depending upon the
Wow.
emotions. They are like our biochemic remedies. Biochemic remedies also act better when they are mixed together. So batch flower remedies also, what is important is find out the emotion, whether it is fear, whether it is insecurity, whether it is lack of confidence, whether it is uh, fear of living alone or something like that. There are 6 groups or 7 groups which Dr. Batch made. So either you learn the remedies based on those 7 groups, or you understand the remedy by keyword. That is how you remember batch flowers. At some level, we could also do some batch flower talk, maybe.
Yeah, that would be very nice.
Yeah.
Because recently I've been doing a lot of batch flower talks everywhere. So
Yeah, that would be very
the
nice.
presentation is ready. So whenever Alexa tells me, we'll start batch flower.
Absolutely. Let's do it. Thank
So
you,
thanks a
everyone.
lot. Thanks a lot,
Thank you,
Alexa, for
everyone.
giving me this opportunity. And
Thank you
it
for
was really
attending.
nice.
Thank
Though
you.
the crowd is not so much, I would really prefer this going to many people, because
Yes, we
it's a
need to.
culmination of a lot of hard
Yeah,
work from my side.
yes,
So,
we will do another webinar that I think we will be able to.
yeah.
Thank you, everyone. Thank you for
Thank
attending.
you very much.
And
Thank you,
and if
so,
you have, thank you, Dr. Chaukkar.
thank you very much. Thank you, Dr. Padmini.
Thank you.
Thank you very much. Thank you, Harold. Thank you, Barbara, very much. Bye bye.
Bye bye.